Friends, today I'm diving into a topic that might stir up some emotions. You might shed a tear, feel a surge of anger, or even think, I am being insensitive. So grab some tissues and let's start. We are going deep into a sensitive subject. Imagine this: you're facing death. Are you at peace? Comfortable? Probably not. You are hooked up to machines, breathing through a ventilator. IV lines are attached to your arms with non-stop beeping of machines. Maybe your legs and arms are tied to the hospital bed for your safety, surrounded by strangers in a sterile hospital room. It's not exactly the serene setting we hope for, is it? Why am I bringing this up? Because there is a startling reality in America that many aren't aware of, and it could change how you approach your own mortality. Did you know that a whopping 80% of people breathe their last breaths in hospitals or in ICUs? They endure immense suffering surrounded by medical equipment instead of loved ones. Now, ask yourself this: when your time comes, where would you rather be? At home, surrounded by familiar faces and memories, or in a sterile hospital bed? I want to hear your thoughts in the comments. Most folks prefer to pass away peacefully at home. Yet, far too many end up in hospitals. Why? Because we tend to overestimate our health and underestimate the end's proximity. Many folks grappling with serious illnesses like cancer or heart failure cling to treatments, hoping far more time, hoping for more time without truly understanding the odds. Doctors too often focus solely on the treating specific ailments, overlooking the bigger picture of you as a whole person, overlooking the end of life care. Most doctors, just like patients, are too uncomfortable to bring the topic of death. And let's talk about CPR, cardiopulmonary resuscitation. It's not the romantic looking CPR they show in TV and movies. It's not the life saving miracle many believe it to be. In reality, its success rate is dismal, often leading to a prolonged suffering rather than a miraculous recovery. And let's not overlook the financial burden. Just one day in the ICU can rack up a bill of $10,000 to $50,000 in a day. Sure, you might not pay the bill directly, but guess who ultimately pays? That's right, your future generations. Medicare might cover it, but it's essentially borrowing from your family's future. Imagine if that money had been invested in education, nutrition, or other avenues that enrich lives. These costly interventions don't just drain our wallets, they drain America's wallet. And what's worse, they prolong suffering for ourselves and our loved ones. It's time we rethink our priorities and consider the true cost of our end of life decisions. As a primary care doctor, I have witnessed the importance of facing mortality head on. By embracing the reality of death, we can make informed decisions and ensure a more dignified end. It's not easy, but it's necessary. I have seen patients choose a graceful exit, surrounded by loved ones, saying their goodbye with peace in their hearts. That's the kind of passing I wish for everyone. So, as you ponder your own mortality, consider how you want your story to end. Share your thoughts in the comments below. Let's start a conversation about life, death, and everything in between.
And other interesting topics related to staying healthy and slowing down the aging process. Stay blessed. Namaste. Adios. Zaizan. Khuda Hafiz. Alvida.